With regards to how to identify patients suitable for prophylaxis in von Willebrand, it really requires a very thorough clinical evaluation of the patient to better understand the type of von Willebrand that they have, which may predict the type of bleeding that they may encounter, or perhaps even their history of bleeding and other comorbidities that may promote bleeding. And I think putting all this together, including perhaps even the lifestyle of a patient, can help us better determine if a patient is a candidate for prophylaxis. And so usually patients who have severe type von Willebrand, such as type 3 von Willebrand, some of the type 2 von Willebrand, as well as a minority of type 1 von Willebrand, may experience bleeding that are severe in nature and severe enough for us to implement prophylaxis. And so as of the current literature, we do not yet have all the data surrounding specifics regarding suitable patients for prophylaxis. And so as of what we know so far, it does require that thorough clinical evaluation. In terms of impact of prophylaxis, I think the goal of prophylaxis is really to try to minimize the burden of the disease, to remove the bleeding outcomes that are associated with these bleeding disorders, to ensure that patients could participate fully with their life and without any impact of their disease on their day-to-day. And that really speaks towards personalization of medicine. The benefit of the 1-to-1 ratio of the plasma-derived von Willebrand concentrate. I think when it comes to management of von Willebrand and bleeding, it's often that patient has a lower than normal factor VIII activity level because von Willebrand functions as a chaperone protein for factor VIII. And so therefore, when you're managing a bleeding event, it's important that you're managing not just the von Willebrand protein, but also the factor VIII protein. And so these concentrates are usually with both von Willebrand as well as factor VIII, which then allows for acute management of a patient. There are other available products that are devoid of factor VIII. And in those situations, usually you have to provide an additional exogenous factor VIII infusion for bleeding management, which is not required if it's in a combined concentrate. Other benefits relates to the pharmacokinetic, the degradation curves of these products. And in my experience, when compared to other von Willebrand containing product that has more von Willebrand than factor VIII, what we see is that the degradation curve of the 1-to-1 ratio is more linear, and so there's less compounding effect with accumulation of factor VIII with multiple dosing. As we know that supratherapeutic levels of factor VIII can certainly promote thrombosis. Whether to use it on demand or surgery, I think all the elements that were discussed were applicable, and so those will be the benefits. In terms of the Health Canada approval, I think that this really underscores a new advancement in hematology. It really speaks to the broader application of prophylaxis in von Willebrand disease. And this would allow for prevention of bleeding and really a change in terms of how we treat patients. We're taking a more proactive approach to try to prevent any bleeding so that patients can proceed on living their best lives without von Willebrand impacting their day-to-day. The significance of prophylaxis in VWD management really speaks towards the paradigm shift. Instead of treating a bleeding event, you're trying to prevent a bleeding event. And that would help improve the patient's quality of life and for them to be able to engage in their day-to-day activities without the disease impacting their life. In my experience, patients on prophylaxis usually reports less bleeding event, less anxiety about engaging in physical activities. They describe fewer time off work, as well as fewer hospitalizations. And so I think all this together really speaks towards the improvement of quality of life that has evolved in vulnerable brain disease management. And truly now we're headed towards precision medicine, which is something profound and great for our patients.